Baltimore. It's Dr. Jeff Kalkstein with Kalkstein Chiropractic, your Baltimore area chiropractor, and I'm with Dave this morning. Dave, how long have you been a client with us?
25 years.
25 years, yeah. And Dave came back in about a week ago?
Yes.
What brought you back in?
Low back pain and tingling in my feet.
Both feet?
Yes.
Yeah. So your journey, you went to your primary, correct, first?
Yes.
Yeah, and she examined you?
She did, and she put me on a steroid pack.
The steroid dose pack?
Yes.
Yeah, with a tapering dose?
Yes.
Yes.
And I didn't get much relief from that.
Okay.
So I called her, then they sent me to a pain doctor.
Right, right.
And he did his examination and decided I needed PT.
PT. So, but he didn't want to give you any epidurals or anything like that, any injections?
No, he said he wanted to try PT first, and
Okay.
then if that didn't work, they'd come back for an injection.
Okay. You came back here over the PT. Why'd you do that?
I've been a client here for 25 plus years, so
Yeah,
it's
yeah. Dave was here last week, and the fellow who referred him, who's been coming here longer than Dave, they both were in the office at the same time.
Yeah.
It was like a reunion for these guys.
One Duffy,
Yeah,
yes.
yeah. So, did you have an MRI?
I did.
Yeah. So, and what was the pain management? What was your primary care's, if you will, diagnosis? What did they say was wrong?
There was some pinching and some narrowing, I think was the word in the report.
Right. So you had some compression on a nerve or pinching of the nerve,
That's,
but you also had some narrowing, right?
yes.
So that's pretty challenging, right? And what I mean by that is the narrowing is called spinal stenosis, and the pinching of the nerve is called radicular pain. And Dave has discomfort down into both legs. And so we did an examination of him. We found some limited range of motion that was really uncomfortable for him. And we found other things too that I don't think you knew about before we did them to you, right? So go ahead and face Carly for me a little bit. And do you have more pain on one side of your back than the other?
Left.
More on the left side. Okay, so let's have you bend to the right, lean to your right. No, we went through
We did.
Dave, he was not in the Marine Corps either. So is that uncomfortable?
Yeah.
Yeah, what side does that bother you on?
Well, right now it's in the middle.
It's right in the middle.
Today.
Now let's go to your other right.
Other right.
Yeah, there you go. Okay, is that
Same.
uncomfortable?
Yeah, yes.
Yeah. Okay. Yeah. Now let's try to do this. Let's put our hands and let's go backwards. Yeah. Is that uncomfortable?
Yes.
Yeah. So step over this way just a little bit so you're facing out that window. And now do the best you can by touching your toes. Just bend forward to your waist. Okay. Yeah. Now come on back up for me. Of those two movements, bending backward or forward, which one's worse?
Forward.
Forward, yeah. So when Dave came in, this is your fourth treatment, right? Correct?
Yes.
And to be honest with you, Dave had decompression, and we did a little bit of this thing called McKenzie. So he's actually better now that he walked in the door, and after just 3 visits, he's even a little better. He could barely get forward like that before he got this grabbing, searing pain, right?
Yes.
Yeah. So we're doing some decompression, and we are doing some, it's called McKenzie. It's a movement direction, and we're also adjusting him. What I did when I examined him the other day is he had some numbness. When I touched both sides of his leg, especially on the left, he didn't feel that as strong. But more importantly, he had some motor weakness when he, remember that big toe?
Yeah.
Did anyone check that? Did the primary care check that? Did the pain manager check your strength at all like that?
The pain guy did.
Yeah,
Yes.
did he find that though? That weakness?
I'm not sure.
Yeah. So, one more time for us. Bend to your right side for me. Yeah. Go ahead to the right. And then go back to the left. Oh, that really grabbed it, doesn't it?
Yeah.
Oh, gosh. I'm lucky I didn't lose it. All right, let's get you to lie on your left side down, your right side up, okay? Left side down, right side up. I'm gonna slip your shoes off, okay?
Yep.
Yeah. So bend your toes towards your nose, and I want you to push down hard into my feet. Push hard, come on, good. Bend your toes back towards your nose, back up again. Hold that for me. Hold that for me, come on, be strong. That away. Hold this one. Hold it. Yeah. So come on over here, Carly. I want everyone to see this. He's got some weakness. It's called dorsiflexion, or actually it's called ankle flexion. Bend the toes back again. So when I do this side, when I do his right side, hold that for me. Solid. Hold this one for me. Come on, hold it. It just gives way, right?
Yeah.
So, and that's so obvious. The other way we check for it to see if he has weakness. So this is a big finding, right? It just tells me how much compression's on that nerve.
Okay.
Either from the stenosis or stuff being pushed up against that nerve.
Okay.
So the signal can't get down to the muscle, if you will, right? So stand against that wall for me. The first thing I'm going to have you do is I want you to get up on your heels and try to walk over towards me, okay? So try to walk towards me. Do the best you can. Which leg do you struggle with?
The left.
Left one, yeah.
Yeah.
Now hold on to that, right? So now go back up on your heels again, right? So stay, resist me. Resist me. Okay,
Yeah.
okay. So now let's go back onto the table, right?
On the back?
Yes, I want the left side down, the right side up. We're gonna go after the right side first. So this is complicated, right? Because he has a little bit of the stenosis, and that doesn't happen overnight. And he definitely has some compression on that nerve, I think. Very specifically, that S1 nerve, okay? So put this hand up like this. So if you could just let this leg drop.
That felt good.
Huh?
That felt good.
Yeah. You know, it looks like it might be somewhat, no, stay there on your back for me. We're gonna do a dog and pony show. It actually was pretty comfortable. That was good, right?
Yeah.
Yeah, now stand up for me. And again, face Carly one more time for me, all right? There you go, okay. All right, now, right is that way. Left is this way.
Do the right first.
Go to the right first. Oh, look at that, yeah.
Yeah. Much
Okay.
better.
Yeah, much better. Much further, less pain, right?
Yes.
Yeah, let's go this way and see what happens on the left side.
A little better, but
Yeah, still there. Still grabs you, right? Yeah.
Yes.
So let's have you face me this way.
right side this time.
Yeah, correct. Right side down. Oh God, us guys in the Navy, we knew our right from our left. You sure you weren't in the Marine Corps?
Is that the dig to the Marines?
It's a dig to the Marines. It's like Army intelligence. You know, is there such a thing, right? Okay, now let that go, nice and loose. There it goes. Run back for me. Very good. Now, okay, so let's have some fun. Rest your head down. Bring your toes towards your nose again. I want you to hold this for me. Hold this. Hold, be strong. Come on, hold. Good. Now, bend your toe back up again. Hold this for me. So do it again one more time. Hold that. Bend that back. Hold that for me.
Not much better.
Yeah, see, that's really nice, right? I've done this in the past where I've had people that were of a younger age, and I've adjusted them like that, and their strength comes back like this. He definitely is stronger. Do you feel that yourself? Do you feel it being stronger when I pulled you?
Yes.
Yeah. So that just means I'm getting some pressure off that nerve, right? Yeah. So go ahead and stand up for me.
Face.
Yes. Now go to your right one more time.
At the right.
There we go. That's really good.
Oh yeah.
Yeah,
Much better.
now come back the other way. Just come into it slowly. Come on over to it. Yeah.
Yeah, oh, wow, much better.
Yeah, go stand up for me. Yeah, see, even that movement's better.
Not a lot of pain.
You know, so
I mean,
part-
a lot less pain.
You know, part of the issue is how much of the stenosis is it bothering you? And one of the things we're doing with them is we're doing a McKenzie, and either you go forward or you go backward with McKenzie. We have Dave going backwards. And a lot of times, you know, like it's 70% of the time we're going to go backwards with somebody. 30% of the time we're going to go forward. And the forward people who like going forward, a lot of times will have some stenosis. And I'm not so sure, I mean, you have stenosis, but I'm not so sure that that's what I call the pain generator in your case, right? So a review of low back could be due from a facet joint.
Okay.
It could be due to a strained muscle or ligament, and it could be due to a disc. The other joint component I'll put in there, there's this thing called the sacroiliac joint, right? Yeah. And so joints are facet joints and sacroiliac joint, muscle problems or disc derangement, a bulging disc, a herniated disc, whatever, right? Yeah, yeah. Let's do this before I keep talking. Bend forward for me and see what that feels like for me.
Oh, better, but see that it pulls.
Yeah, that's okay. That's significant. See,
Oh,
when he first came down here, his fingers weren't below his neck.
Right.
It was high. So that's really nice, right? So what we're doing some decompression. All right. So you can check out some of that on our line. The other thing we're having is he's standing up. Go ahead and do one with me. Arch backwards for me now. Yeah.
Oh, that's much better.
1001. Now come back up again for me. Do it again. Breathe in, exhale, all the way back. There you go, right? That way. Keep your knees straight, don't bend your knees. I want you to feel that compression back there.
Yeah.
Take the pressure off of it now. So he's not gonna go back there and hold that. Do another one more time. Breathe in, exhale, go all the way back. There you go, 1001, 1002, let the pressure off. Okay, so if you sit for any length of time, more than 45 minutes to an hour, even if you get out of the car, you get up and you do 10, 20 of those until you feel like that pressure's off your back.
Okay.
Do not sit at home on the couch. Did I go over how to sit with that roll there with you?
No.
No. So let's do that real quick here. What we're going to do, we want to ensure that he has this lumbar curve or this lumbar lordosis. So we're going to take this roll, which is also called a Mackenzie roll, and we're going to slide it back in there, because when people sit, they slouch, and when you slouch, you put more pressure on the disc, and we don't want that, because that's what's generating the pain, I think, right now, okay? So let's have you have a seat here. Now sit back and drive your femurs back to the back of the chair. Yeah, there you go. Okay, that's how I want you to sit.
Okay.
So when you're driving your car, take that lumbar support and push it out all the way out. So
Okay.
your belly button's going forward, right? Stay off the couch at home.
Okay.
Sit in a chair that has a nice back to it and a nice firmness to
firm.
it. And you either get one of these, or you can make your own by rolling a towel up, put some rubber bands on it. I like these better, right? Yeah. Okay?
Okay.
Yeah. So this is complicated because he has muscle weakness. We want to get rid of that muscle weakness as fast as we can. So we're probably going to be a little bit more aggressive on how often we see it. Would we see it 3 times?
Yeah, 3 times.
Less. How much better do you feel now compared to you walked in just today? 20% less pain, 30% less pain?
Probably 40%.
40%.
Yeah.
And his movements
Yeah, I'm getting
much better, yeah. But we have some work to do. Okay? So your homework at home is these Mackenzies all day long.
Okay.
Until you get back in here on Monday, right? So next week we're gonna go Monday, Wednesday, Friday.
Okay.
And you can see me or you can see one of the docs in the office.
Okay.
Okay? Yeah. Any other questions?
No, it's
Yeah.
very helpful.
Yeah, that's good. Thank you, Baltimore.